what is unusual is this amount of distension. It shouldn't be there.
Hi everyone, I'm Lynn from Cavy Central Guinea Pig Rescue.
Okay, so we have got Bunny here, and Bunny was found in a park. Which park was it?
Just opposite my road in North Ryde, just a reserve at the end of the road.
But we had another one that was dumped in a reserve there.
Really?
Yeah, we did, and he was young as well, and he was white as well. He's here, he was caught, so yeah. Anyway, something's by the by. That was actually in the same area, and that was the same sort of time frame. So that's interesting. Possibly they were dumped at the same time. So
well, at least he got rescued too.
Absolutely, yeah. The community, there's a community page, and they all went down to try and catch him, and they eventually caught him that way.
Okay.
So,
wow.
yeah, so I've got all of that I can tell. But anyway, so Bunny has come in to meet a friend. Bunny was found in an area where guinea pigs shouldn't be, probably abandoned, and he's a male. He's super cute and super loved now. He was very underweight and thin. He's regained a lot of his weight, and he's now been desexed. So he's come to meet a friend, but the desexing has only occurred recently, and we're going to just take a little look here at what we can see. So it was 2 weeks ago, but what is unusual is this amount of distension. It shouldn't be there. There's potential fluid that's building up in here, and they can actually get prolapses. In particular, you can feel in where the testes are very swollen. There's a great deal of swelling there. So Bunny's going to go back to the vet and get some antibiotics, because he was just on pain relief for this. But this is still very sore, and certainly that level of distension 2 weeks later is not normal. So this needs to be checked out more thoroughly. This is one of the problems with desexing, in that if you don't know what to look for, there can be a problem that's brewing. So with that, I'm going to get another little fellow called Lily that everyone's familiar with. I'll give you Bunny back for a minute. Here's Lily. Now Lily is one of 3 guinea pigs that came into us in horrendous condition, and they're all still here with us. But Lily recently, as in 6 to 8 weeks ago, also went through desexing. So the desexing process was absolutely fine. This little fellow came in completely hairless to us, so there's a story about him. But he's called Lily, he's a he, but we've kept his name. So Lily was desexed 6 to 8 weeks ago, and everything went well. Everything settled down really well until a week ago, when suddenly Lily got this occurring. You can see this swelling that's here, but when it came up, it was enormous. So it was an abscessed infected area, and what we're having to do is drain that. He's now on antibiotics, and we drain that every few days. So this is to show you what is abnormal in a guinea pig, because you don't see any of that. With a desexed male, it should be really nice and flat. That should not be there.
It's never flat.
No, but that's really raised at the moment, worryingly so. So with this little fellow, and it's way smaller, that little lump is way smaller now than it was originally, but it shows you some of the issues with desexing, and that it can take weeks and weeks for something to actually eventuate. So with guinea pigs, we always say that they need to be kept separate once they're desexed from females for up to 4 weeks. The reason for that is that during the process of desexing, there can still be residual sperm within the channel that can literally travel down over time. So in order to prevent unwanted pregnancies, and also that they can still be so sore there for some time. Like, we can think it's a quick process, and within 3 days they're starting to feel a whole lot better, but they're still sore there for some time. So for all of those reasons, we recommend that they remain separate for 4 weeks till you can ensure that everything is tickety-boo in that area. It's too easy to have guinea pigs, and we see it all the time with other things. They look gorgeous, they're gaining weight, their coat's coming back, but it's the underside that actually reveals so much more to us. So yeah, so there's something in that. Lily, you are getting better, which is great. But these things happen. You can also have, within any D-sex, you can have hernias occur in that area. That's quite common, and it's also what's occurred here. But when that does happen, you get fluid that gets through and can build in different areas. Infection can also result. So you need to get on top of that.
Yep, absolutely. Today.
All right, so I'm going to pop you away, little fellow, and we'll do you. So this little fellow, this little guy was dumped at a vet in the mountains. I'm just trying to think of the name. Currajong vets. They arrived at work and they found a cage which actually had come open, and they were out running around, so they had to catch. There were 4 of them. They hoped they caught all of them that were literally dumped at the vet. But this little fellow has been desexed now 4 weeks ago, and to show you the difference in how it should look, here's a pretty good example. But completely flat, no swelling, and you can see no swelling, nothing. And that should be evident from easily 2 weeks, easily 2 weeks, if not a week. So the swelling that's occurring on the other boy is very abnormal. You can feel like there's no tissue, no lumps, nothing in there. So there's fluid in there. But get him down to the vet, and we'll get him on antibiotics. They'll drain that fluid that's there, like we're doing, and give him the appropriate medication. They can test it and then go from there. Okay. So yeah, when you do get them desexed, this is what it should be done. But again, in the case of the little fellow Lily, he has a hernia that's resulted in that area, and it occurred 5-6 weeks later. So they're very, this is surgery that occurs, and we treat it, or we hear of people treating it as though it's a simple operation, but for several months after, they're delicate and things can happen, problems can arise. So with any animal that has abdominal surgery or surgery in any way, you need to always continually check those areas and make sure everything's as it should be. Yeah.